Hi, I'm Dr. Asghar Husain, orthopedic surgeon. Today's quick question: do broken bones need to be immobilized in order to heal? Quick answer, not necessarily. We have information for decades that shows that when you take a broken part and you start to move it, you actually will improve the healing. That means you speed it up. But time and time again, I see people who have had 4 weeks, 6 weeks, 8 weeks, 12 weeks. They've been stuck into a cast. And guess what? What's inside there? Well, you have the joint. So you have the cartilage of the joint, you have the muscle, you have the tendon, you have the ligaments, and you have the bone, and that's all shut down. So now someone has a really, really, really long recovery. So I tell somebody, if they say, hey, do I need to be casted for 6 weeks? I say, do you want a long recovery or do you want just the right amount of recovery? So the point is, if you break apart and they're way off and they need to be fixed, what I'm saying doesn't necessarily apply. But if you have a broken bone that can be treated non-surgically, which means you want to see a healthcare provider who can help you make that decision, then generally what I have found is if you think about what is the body doing, well, within about a week or two, it bleeds and it starts to form an interface where things start to glue together. When it starts to glue together, at that point in time, which is usually around the second week, we find that you can actually get that part moving. And when you do that, the body will respond and your muscles stay elastic. You get a little bit of muscle tension. The bones get a little bit of stress and they heal a little bit faster. So ultimately, there may be a role for short-term immobilization for a break that needs to be treated non-surgically. But generally, if you want to regain your function, then as you start getting it moving, you are now better poised in order to recover in an active recovery way that I've said in previous videos so that you can start getting it stronger when the time is right. And typically we'll actually follow pain through this too. So generally what we find is around week 2, week 3, pain comes down, and then I like to get people moving, try to get your full motion and start working on the recovery from there.
How do they move if they're in a cast? Because they don't put the cast for 2 weeks, right?
Correct.
So how do you move? I mean, it depends on where the bone is broken.
That's right. Let's just say an elbow. You splint somebody, at least for me, many times if someone has a break that can be treated non-surgically, I'll put them in a sling. We'll even get them to start moving a little bit right away.
You're saying if their elbow breaks?
Correct.
Okay, like if the break is right at the elbow, then you
It
just put it in a
depends.
sling.
This is someone who can be treated non-surgically.
Okay.
Someone who's fixed, everything I'm saying won't apply.
Okay. So if you break, let's say, a femur, right? Like in the middle of your femur.
It's a different thing. That's a break that often requires a surgery. And actually, even to qualify that, interestingly enough, even if you do have a surgery, in fact, especially if you have a surgery, there are most people, for me, if you fix somebody and you fix them and you feel like this is stable now, I will get them moving full right away for the same reasons that I just said. Because if you fix someone, let's just say you've got a broken collarbone and you fix it and you stick somebody in a sling, everything shuts down. But if you fix them and you tell them, hey, look, you can get the arm moving full right away, their recovery hastens. And because you've already got the bone pieces together, you allow the muscles and the tendons and the ligaments and the tissues all around it to stay healthier and to stay active.
So when you're saying fix them, like let's say the collarbone, you mean there's something surgically in that injury that's holding that bone together?
Yes.
Okay, so that's why you don't need to have that immobilized.
Right. Yes, exactly.
So you just immobilize it long enough for that fusion to happen, that you're saying that 2 weeks where the bone starts fusing and doing all that business, then start using your arm and start using your shoulder and start using...
Exactly. And actually, these are very old principles that go back to decades. When I visited Switzerland years ago, the Swiss developed a lot of these principles, which is they said, hey, if you're going to do a surgery, fix it, but then start early motion. And somewhere down the line, I think we've kind of forgotten that. So I think physicians out there, if you're fixing somebody and it's stable, get them moving. Because we know that when you get a part moving, when you load it, you put just the right amount of load, you actually will stimulate the healing and allow them to get back to their lives faster.
So in the cases where people have a break where they have a cast and it's sitting on there for God knows how long, right? How do they, what can they do?
Well, ideally, this has to be planned on the physician side. Right. On my end, when I see someone, if they need some immobilization, we make a strategy so we have the least amount of time. We use pain as a guide. We make sure the pain is coming down. If the pieces are where they need to be, we get them to move carefully and thoughtfully, a little bit at a time, dialing in the movement that they need, dialing in the amount that their muscles can work with, dialing in the amount of loading, how much pushing and pulling they can do. We do it a little bit at a time.
Okay, so there's always something you're saying that can be done.
There's always something that can be done. You just have to be thoughtful about it and not formulaic. The formula idea in medical care, that needs to go. What we need to really do is individualize what we're doing and try to make sure that whatever plan we have specifically fits the person and what their goals are.
And if you break your arm, that's not an excuse to not do any exercise for the next 6 weeks.
Correct. Don't lay in bed and watch Netflix.
Right.